talking to the service deliverers of today, their greatest challenge is around how they can get the most effective service model in place.
The advent of advanced clinical practice for AHPs, and certainly my role as consultant radiographer, has opened up enormous opportunity.
If a patient comes for an X-ray, what the patient wants is not the X-ray as quickly as they can, they want the answer as quickly as they can. Advanced practice within reporting helps to deliver that.
There is established diagnostic capacity barriers, and one way to introduce sustainable, safe and effective diagnostic capacity is to introduce integrated radiographer reporting.
Many of the health professionals that we have in play today have many more skills and have much more capability and capacity than we're using at present. The idea is that we work with our medical colleagues to actually redefine some of the roles so that we can actually have a very different service delivery model tomorrow, but one which nonetheless is focused very much on the needs of patients.
At Homerson, we've taken a proactive and planned approach to the use of radiographer reporting, and it's allowed us to deal with the activity demands as they increase.
With reporting radiographers and increasing the number and bringing them into your department and training them, it's not about replacing consultant radiologists, it's about making sure they do the activities they are best qualified for.
One of these new ways of working is therapeutic radiography, and the advancement there in terms of the training skill set of our practicing radiographers.
Being the first consultant radiographer locally in this trust, people were curious as to what the role would actually mean and what it would add to the service. The idea is that the scope of practice of my role would lend itself to working in a complementary fashion with the oncologists.
When we developed the post, we looked at where the gap in the service was, and the training that then Neil had was to fill that gap.
We're not trying to pretend that Neil is a full medic. He isn't. He's taking on some of the duties within a confined scope of practice, but it just shows that it's doable to replace that traditional model with a new model.
So it's obviously just an AP projection.
What we have to do nationally, of course, is make sure that where these developments are occurring, we have a standard model across the country that everybody knows that if you're trained in a particular field of extended role or advanced practice in Blackpool, that you can get exactly the same standard of delivery and expertise in Canterbury.
Radiographers can't report from day one. That requires postgraduate education. You've got the clinical history there in terms of referral.
In terms of the scope of reporting radiographer practice, it is based initially on the framework that we have set up for qualifications initially, in terms of going through the relevant qualification processes for the reporting radiographer to start to report here. And then we apply our own level of assessment on top of that before we allow autonomous practice within the department.
With many of these advanced clinical practitioners right now, we will see them sitting alongside trainee medics, registrars, junior doctors, working and training alongside them. So they're all part of that information exchange, those quality audits, all of the clinical governance arrangements, all of those things that we know have served doctors well over the years are now available to advanced clinical practitioners. This is about taking those clinicians forward with a very different model of care so that we can get a truly integrated approach.
Radiographers reporting radiographs is nothing new, but embedding it in practice is. What we need to do is actually make sure individuals are utilised to their full scope.
We are able to demonstrate that therapeutic radiographers can prescribe and deliver radiotherapy and take on some of the more traditional clinician roles and do it successfully.
We know from research that the ability of the clinicians is improved by adding our report into the patient pathway. We've got research that shows immediate interpretations can reduce spend, can reduce journey times, can actually reduce the number of patients admitted to hospital and bed stays.
There'll always be gaps in the workforce, and it's looking at how we can best use the existing skills we have. In terms of the future, it's there for us to make.